It's time for another GI focus on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, I'm Tina Nunziato, and with me is the beautiful Dr. Liz Cruz. Welcome, Dr. Cruz,
Thank you,
to
Tina.
your show. We are doing another GI focus, and so as any of you have been listening to our podcast, you know that when we do a GI focus, I lead out and ask Dr. Cruz all the questions, and she has to answer them. No pressure. Okay, so this next GI focus is going to be on anal fissures.
Anal fissures.
I can't believe we haven't done a podcast on anal fissures yet.
Yeah, me too.
It's pretty crazy.
Yeah.
Anyway, we're just constantly coming up with podcast ideas. And if any of you are out there and have an idea or want to learn about something, please let us know and we will talk about it.
Absolutely.
Okay, so anal fissures. Dr. Cruz, please define what are anal fissures.
All right. I'm going to keep it very simple. An anal fissure is literally just a tear in the lining of the anus.
It sounds very painful.
It can be very painful. Well, I have never personally experienced, but anyone that I've ever treated with anal fissures will describe that it feels like as the stool is going through, it feels like a piece of glass is just scraping in the anus.
Okay.
Imagine that.
That's actually very descriptive.
That's the way they describe it.
Yes. So tell me, how do we get anal fissures?
So, there's different things that can cause anal fissures. I would say probably the most common thing, the most common cause that I have found through the years of doing this has been someone who is really constipated and has been passing hard stool, straining, passing hard stool, and in the passing of the hard stool, may just get a little tear there. It can also be caused by certain infections. Some people have asked me if an anal fissure is a sexually transmitted disease. No, it is not. However, people who do get certain sexually transmitted infections can develop anal fissures. And let's see, you can get anal fissures from anal sex, trauma, to that area. But I would say by far the most common thing that I've seen through the years with my patients has been in someone who's just really chronically constipated and struggling with passing stool. And now they pass this hard stool and it just literally, it's so hard as it stretches in the anal canal, it just tears it a little bit, causes a tear.
And how do you diagnose an anal fissure?
So usually a patient will describe anal pain. Okay, they'll describe that they're having anal pain, especially when they pass stool. They may have some bleeding along with the pain, but that typically is the most common symptoms or complaint that I may hear from a patient.
But so could someone have an anal fissure and only feel it when they're passing stool? Or is it typically pain all the time?
Yeah, I've had patients who they have such a tear, such a big tear, or maybe they had a tear, it kind of healed, and now it tears again with a stool, who will feel that pain, like not only when they pass stool, but because it's not healing, they just feel a discomfort there in the anus. And they'll feel it, they'll just feel it there, even and it just worsens when then they go to have a bowel movement.
But how do you say, yes, it's an anal fissure? Are you doing a rectal exam? Do you have to do a colonoscopy? What is typically the way you say?
Typically, yes? I suspect it just based on what they're describing. But then when I do a rectal exam, I can feel it. I can tip it. You can feel that. You can feel that tear.
Does your finger literally go through the colon?
Does your finger
when you do the rectal exam?
You mean like through the anal canal?
No, when you go into the anal canal, does the tear have to go through? There's no perforation, I guess is what I'm saying.
No. It's just in the anal canal where you have a tear of that mucosa, that lining. And actually, but you just made me think of the fact that when a lot of times I can't even put my finger all the way through because
Mhm.
it hurts so much.
Mm.
Like I will start doing the rectal exam
Mhm.
and start kind of pushing through the anus, and they're,
They're like jumping off the
yeah, they're
table.
jumping off the table.
Mhm.
And so sometimes I can't even finish it,
So
but most of the time I can still get a little feel.
Mhm.
Sometimes I can, when I expand their butt cheeks and open it up to take a look in there,
Mhm.
I could see like irritation in that area, but
Mhm.
usually I can just feel it.
So it's basically just a really bad cut
Yeah,
on the
yeah.
inside.
It's just a little tear.
Perforate
It's a little
through.
tear. I have not seen anyone perforate through. I mean, you've got your sphincter muscle right there. So I've never seen it. I mean, maybe it has happened. Maybe a colorectal surgeon has seen it. I've never seen it in my over 20 years of doing this.
And when you do diagnose someone and confirm that yes, it's an anal fissure, what do you do to help it to heal?
Okay, so typically, you have to really explain the importance of their stools being soft. They need to be on high fiber. Usually I'll put them on stool softeners or some sort of a laxative to soften up their stools. A lot of times also I will recommend that they do some warm tub bath, like sitz bath, where they actually sit in the tub with some warm water and sit in there to let their butts soak in the warm water for like 15-20 minutes. If they can do that 2 or 3 times a day, that's going to help also. A lot of times I will prescribe them some ointment to put in that area. There's a couple different things that I've used through the years. One of them is nitroglycerin ointment, which basically helps to dilate the blood vessels in that area to bring more blood in there to help
it
heal faster. Yeah, and also it helps with decreasing the spasms, because one of the things with someone with anal fissures is that because it gets so tense because of the pain in that area, their rectal muscles will tend to spasm, and then that adds to the discomfort that they're having. Not only are they having pain in the anal area, but now their rectum is spasming, and it's very painful, very painful. So the nitroglycerin also helps with that. There are some medicines that are used for treating blood pressure. They're calcium channel blockers, like diltiazem is a very common one that actually has an ointment form of it. It's an ointment that you can use to put in that area also, that just helps to relax that area. And also a lot of times getting a combination of like diltiazem and lidocaine, which the lidocaine will help numb up the pain. Okay. Especially, when it's a fresh tear and they're having a lot of pain, you want to give them something that will also help with the pain. And the lidocaine will also help with numbing up the pain that they're having as it's healing.
It's a lot of lubes up there.
It's a lot of lubes. It's a lot, and they have to be consistent. Like they have to be putting this stuff in there consistently for like several weeks.
Yeah. So like how long?
6 to 8 weeks. I mean,
6 to 8 weeks for an anal fissure to heal.
I mean, look, it's just that it's tough to do it consistently. Okay. People are working, so maybe they can't do it 3 times a day.
Imagine doing that at work.
People have a hard time even just doing it because it's back there. And it's like,
nobody likes putting stuff up there.
That
tends to be an outward,
an exit,
area, an exit, not an entry.
Yeah. But listen, these people, I always feel so bad for them because they're having so much pain. So they can heal up, but it's gonna take intentional effort to do all these things. You got to get those stools soft. You got to drink a lot of water, get some fiber in there, do some sitz bath, and then be putting some little ointments in there.
What about being on the enzymes, probiotics, and salts during
absolutely.
that time? I mean, especially to help.
Yeah, I mean,
keep the bowels
definitely,
moving.
absolutely. I mean, look, it's natural. It's, the probiotics are also going to help with the bowel movements. The salts with the shots, especially if they're constipated, that's going to help. And if you want more information with that, you can definitely, please reach out to us, because there's a lot that goes with that. But it definitely takes, it's a regimented plan to try to get them better. Okay. Because if they don't get better, these are the people then that we have to send over to the colorectal surgeon.
I was going to ask, so what happens if the anal fissure doesn't, like, they can't clear up the constipation, the anal fissure doesn't go away, it just gets worse? I mean, is there like surgery then at that
absolutely.
point? Okay.
I mean, you can even get a Botox injection in there, like where the sphincter is. It helps to relax that muscle. So Botox, there's surgery where they can go in and they're literally doing a little cut of the sphincter to kind of loosen it up a little bit.
Are they ever like sewing the fissure?
So sometimes if it's a chronic fissure that hasn't healed up and now you're just continuing to tear and now you've just got this scar tissue in there, sometimes they can go in and do what they call the fissurectomy, I think is what they call it, where they cut that scar tissue out of there.
I see.
You know, you can get the development of skin tags. I mean, yeah, you can develop a lot of scar tissue in that area if you're continuing to have these chronic fissures that are just not healing up. And so it's so important to, you know, if the issue is constipation, it's so important to address that. So important to address that, and to get that under control. Because if not, you are going to continue to have these fissures. I mean, it's going to happen because if the initial fissure doesn't heal up well, it's going to tear open very easily again. And so it's really important to get to the root cause, and get that, worked out. If it's constipation, and very important. If it's anal sex, you know, I mean, trying to figure that out because, I mean, I'm just going to be very blunt about it. If it's because there's, you know, anal sex, penetration, either with a sex toy or penile penetration, and it's just continuing to tear, that can be an issue, you know? And so there's got to be, I don't know, reach out to us and we'll talk about it.
Maybe some other sexual strategies.
Yeah.
I don't know. Yeah, at least temporarily.
Yeah.
Until the area is healed.
Absolutely.
Yeah.
Absolutely.
Well, thank you, Dr. Cruz. Anything else on anal fissures that you'd like to address that I didn't ask you about?
No, I mean, that was actually a great topic. And if you have any questions or anything that you want to ask us about it that we didn't address, please reach out to us.
Yes. Yeah. And if you haven't already subscribed, please subscribe to our show. If you want to connect with us, please go to our website, drlizcruz.com. There is a magenta colored button you can click to schedule a free 30-minute consult from no matter where you are in the world. And please rate our show, give us a 5-star so that other people just like you can find us, and subscribe to the show so that you don't miss any more. And we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.